Greetings, sacred clients, and Happy New Year. I am Kirby Clark Ellis, MMT, BCT, MB. You've heard me talk about how cranial sacral therapy is going to become a regular part of my massage therapy practice. You may have even seen it added to my menu of services. But what exactly is cranial sacral therapy, and what does a session look like? Let's get into it. Cranial Sacral Therapy, or CST, is a modality of massage therapy with origins in osteopathy. It features gentle, sustained pressure, usually for a duration of 2 to 5 minutes, applied through the hands and fingertips to obtain very subtle changes in the cranial sacral system. This modality is not what you would typically expect from a massage session. The service is provided with the client clothed, with specific holds along the spine and cranium. The craniosacral system is all the space that contains the central nervous system, which also includes the brain and spinal cord, the cranial bones, and of course, cerebrospinal fluid. The primary intention when working with the craniosacral system is to release restrictions in the structures and fluids of the system. This facilitates self-regulating and self-healing mechanisms within the whole body. The simplest way to describe CST that I've heard is that practitioners are holding a mirror up to the body, and with access to its own reflection, it will self-correct. The normal rate of craniosacral rhythm, which is the rhythm of the cerebrospinal fluid, is 6 to 12 cycles or pulses per minute. The pulse is created by the expansion and constriction of the cerebrospinal fluid. Maintaining healthy and normal cerebrospinal fluid rhythms is essential to health because the cerebrospinal fluid is responsible for cell growth and cell instruction, and it helps transmit light, vibration, and hormones along the spine. Because the craniosacral system is made up of the brain and spinal cord, it has direct impacts on the central nervous system and indirect influences on all other body systems that the central nervous system has an effect on. Clients will report gentle and natural release of stress and trauma that has been indefinitely held within the body, relief or resolution of chronic conditions, accelerated injury recovery, deep relaxation and improved sleep quality, mental clarity or coherence and emotional stability, and a feeling of overall well-being and complete refreshment after a session. Cranial sacral therapy is known for multitudes of clinical applications and positive results for thousands of conditions. Cranial sacral therapy can almost always help clients struggling with almost any condition, even if it only serves to support and improve success of other therapies. Adverse side effects of cranial sacral treatment are uncommon, but conditions that can contraindicate the use of CST include any condition where the changing of intracranial pressure would be harmful.